Good afternoon, participants. Today we have in this session, that is the third session of third day of our FDP. We have Dr. Naina Sharma from Psychology Department of Punjab University, Patiala. So we welcome ma'am and thank you for accepting our invitation for this session. Thank you very much. So let me
Thank
introduce.
you for the invitation.
Thank you, ma'am. So if we are ready, then we can start.
Sure, I have no issues. Like if the participants are there, we can just start on.
Okay, let me introduce you with the audience. Then we can start. So participants, we have Dr. Naina Sharma, professor from Department of Psychology at Punjab University, Patiala. In this session, ma'am is also working as coordinator of Punjab for the school-based teenage education program. And ma'am has developed two postgraduate diploma courses. One is postgraduate diploma in HIV/AIDS counseling and postgraduate diploma in counseling for substance abuse prevention and treatment. Ma'am has also associated as a resource person with Global Fund to fight AIDS, TB, and malaria. Ma'am have been associated with Center of Women Studies at Punjab University, Patiala, and have been involved in many projects like rural development, gender sensitization program, coordinating workshops and conferences at national and international level. So, ma'am have been invited by the Doordarshan, Punjabi, Chardi Kala, and Akashvani as an expert to share the views regarding parenting skills, relationship counseling, and HIV/AIDS awareness. Ma'am also has been invited as a resource person in various colleges and schools for conducting workshops and lectures on the topics related to emotional intelligence, anger management, gender sensitization, catalyzing teaching skills, and development of soft skills in the youth. So, Madam was a team member of the project Indian European Research Networking Program on school bullying, cyberbullying, pupil safety, and well-being. So, Madam was also nominated as a member of Punjab State Drug Prevention Committee. Ma'am has published more than 20 papers in national and international journals, participated and presented 30 papers in national and international conferences, and conducted 15 workshops on various psychosocial issues for diverse populations. Ma'am also fellow member of various bodies or academies like she's member of Institute of Scholars, Social Research Foundation, Punjab State Drug Prevention Committee. So ma'am is a fellow of all these organizations. So we welcome ma'am to this session and we request you to address the audience now. Thank you. Over to you, ma'am.
Thank you so much. Thanks a lot. So, yeah. All right. So, as such, the topic that we have chosen for today is the stress management, right? It's basically like how to prevent and how to manage it. First thing is that we'll be focusing on, like, we need to understand like what stress is actually. Since it's not a biological class and it's a psychological intervention that we'll be talking about, first of all, I would like to highlight a few ground rules because all these sessions, psychological sessions, I believe, they're of no use if in case it's just a monologue. Like I would really appreciate if in case we can indulge into an interactive dialogue, or it should be like from the both sides, like the audience should also be, participating in it actively. So I want an active participation from the audience because this is very close to your life and you're going through it. It would be wonderful if in case we can talk more about it. And since there are individual differences, you would actually know what strategy can suit you more in managing the stress. Then we have to be very, very honest in giving the responses. I'll be sharing the questionnaire also for you to fill up. And I assure you the confidentiality, and we need to respect and adjust to the individual differences all through. So I'll see if in case it's ready to be. No, it's not connecting, sir. It's not allowing me to share. Okay, we can just start on then. First thing is, what do you understand by stress? And The word stress has taken so much of importance, relevance in today's world. Like if in case I talk to or I counsel even a small child, like just a 3-year-old girl, and she came with her parents, like the parents said that this is a hyperactive kid, ma'am, please see if in case some counseling can be given to her. I asked her, I just indulged into, the counseling process, the session. And I asked her, like, okay, what is your name? And like, we just started on with it, breaking the ice. Then she said, पता है कितना stress होता है मेरे को? So, like a 3-year-old child using the word stress, like I was taken aback because stress आपको. So like what is coming out of it is that ये इतना pandemic की तरह, like and then we are not understanding it that stress can have a positive impact as well. जो stress को ले रहे हैं, जो एक mindset, like we have formulated a mindset that stress is just a negative occurrence, or stress is something that is that we need to have it, that indicates that we are busy. Stress is something that is inevitable, it has to be there, right? अगर हम psychological terms में कहते हैं तो उसको stress is just the psychological, physiological and behavioral response by an individual when they perceive a lack of equilibrium between the demands placed upon them and their ability to meet those demands, which over a period of time leads to ill health. Like as such, in literal terms, when we say stress kya hota hai, pressure hai. When some kind of a pressure is mounted on you and you're not able to maintain that equilibrium or that balance, you are in a state of, or you just simply consider it to be in a state of stress. अब इसके जो हेल्थ सिलाए in 1974 discussed 4 variations of stress. That is, one is that when a person perceives a stressor is positive, उसको eustress का नाम दिया गया, eustress. That is when the consequences are considered to be positive, but you are in a state of pressure. There are certain demands on you, but you consider the consequences to be pleasant ones. That is considered to be a eustress. For example, there is a wedding in the family. So in that time of that phase, there is a lot of stress that you have to, do certain things in the family, maintain everything. Then that becomes, but then you're happily doing it. You're maintaining everything, you're managing everything in a state of happiness. So that is termed as eustress. Then there is a distress. Distress is that when the consequences are associated with the stressor to be a negative one. Like for example, any one of your close family member is hospitalized. Now, being hospitalized, the consequences like considered to be negative. Like you consider that what would happen. There is a feeling of, anxiety, like he may not recover or he would recover. Then that taking care of that person, going to the hospital, visiting the patient time and again, that may lead to distress because the consequences are negatively associated with it. Then stress can be a hyper stress or it can be a hypo stress. Like hyper stress is when you're taking too much of stress, बहुत ज़्यादा, like when before I start on with anything, like take the example, छोटे होते examination है, like if there is a कोई भी exam ਹੁੰਦਾ सीगा, like some individuals would be in a state of a hyper stress, a lot of stress कि okay सारी रात भी पढ़ना है, उसके बाद चक्कर आ रहे हैं, nausea हो रहे हैं, just because of that kind of that is a typical state of a hyper stress, like they consider it, they take too much out of it. Then one is a hypo stress. The other extreme of it is that even if in case you know that you have an exam, you are not preparing for it at all. That is a stage of hypo stress. Now, hence Salai in 1974 specifically mentioned that it is extremely important for us to maintain the balance. That is extremely important for us to understand that we have to have the balance out of it. Like the consequences, even if in case they are negative, but we are still in a position to move out in a more positive way, and we have to maintain a balance between hyper stress and hypo stress. Imagine if in case there is an interview and you do not prepare at all because of the state of hypo stress, that will also affect your performance. But imagine an interview where you are totally lost, or you are too much stressed and you are in a state of anxiety and you're not able to perform at all during that interview. That is a state of hyper stress. So the most important for all of us is to understand that what all we will be talking about today is that is stress is inevitable. You whatever, like there are as many as stimulations we have, it can be like any normal day, and any out of the normal day you might feel that there is a overwork, or you might feel that there's too much of traffic. That stress is inevitable, but then how you perceive it, how you handle it, how you understand it, all your defense mechanisms, your personality would ultimately affect that how you are dealing with it effectively, right? So thoda sa I need to give you a background, a biological background, that how stress response actually takes place. You might have read a lot about HPA axis, stress response feedback. HPA, what does it indicate? जो भी ये stress mechanism है, वो hypothalamus से शुरू होता है. Whenever there is an environmental stressor, it starts from the hypothalamus. That is any indication, कोई भी stimulation जो hypothalamus की होगी stress के लिए, वो जो है CRH को produce करता है. Hypothalamus actually produces corticotropin releasing hormone. अब CRH फर्दर पिट्यूटरी ग्लैंड के पास जाता है, पिट्यूटरी ग्लैंड से ACTH रिलीज होता है. ACTH अनदर हार्मोन जो एड्रीनल ग्लैंड्स के पास जाके कॉर्टिसोल्स को प्रोड्यूस करता है. अब जो कॉर्टिसोल्स हैं दे आर वेरी गुड आल्सो, एंड बट इफ इन केस प्रोलॉन्ग हो जाते हैं तो ये हमारे जो सारा इम्यून सिस्टम है या उसको डैमेज करने लगते हैं. बेसिकली कॉर्टिसोल के रिलीज होने क्या होता है, increases, and then there is an extra energy, or there is an ability to fight, or basic हमारा stress response कहाँ से शुरू हुआ है, that is fight or flight reaction. So जब एकदम से energy, जब एक hypothalamus आपको ये मैं simplest terms में आपको बता रही हूँ कि जब आपको कोई भी environmental stressor है, for example like you get to know that you're going for a wedding, ठीक है, किसी की wedding attend करनी है, immediately hypothalamus आपको एक indication कि there is a pressure, like you have to make the preparations. Hypothalamus would secrete CRH, corticotropin releasing hormones, वो pituitary gland को ACTH करते हैं release, ACTH adrenal glands को में cortisol को release करते हैं, जिसके कारण आप में अचानक से बहुत सारी ऊर्जा, जैसे कहते हैं a lot of energy, glucose is released in your body, जिसकी वजह से आप में एक मेटाबॉलिज्म फास्ट हो जाता है, आपकी एनर्जी लेवल हाई हो जाता है, दैट यू कैन डील, यू कैन एक्चुअली मैनेज दैट. दिस इज अ बेसिकली बायोलॉजिकल रिस्पॉन्स, वी कॉल इट एज HPA एक्सिस स्ट्रेस रिस्पॉन्स फीडबैक. उसके बाद ये अपने आप नॉर्मल लेवल पे भी चला जाता है. लाइक जब ये कॉर्टिसोल रिलीज होते हैं उसके बाद इतनी मात्रा में रिलीज हो जाते हैं that they again those cortisols send a message to the hypothalamus to seize CRH, जिसकी वजह से cortisols दोबारा बैलेंस में आ जाते हैं. That is it is extremely important to be in a state of equilibrium. So अब तक my point over here is that stress जो है एक automatic biological response भी है, एक ये automatically हमें induced system है, biological system है, जिसके साथ आप prepared होते हो to either fight or flight. Like the basic energy is there within your body that whenever you perceive that there is some kind of a pressure, there is some kind of a stress, then there is an automatic biological response that is aroused as a part of your biology. But the important thing that we should not miss out over here is this is the last part जो बायोलॉजी के साथ रिलेटेड है, उसके बाद सारा साइकोलॉजी के साथ रिलेटेड है. ये बायोलॉजी थोड़ी सी इसलिए बताई है जस्ट टू मेक यू अवेयर that at times जो हमारे में hormonal changes आ जाती हैं, हमारे लिए like at times it becomes very difficult for ourselves to understand and control our mechanisms that may be the result of your biological mechanisms, right? So psychology or biology, mind and body cannot be separated. Howsoever your mind is perceiving, it is giving a signal to your body starts releasing those kind of the hormones which prepare you to fight with the stressor. अब क्या होता है कि एक टेलोमर्स हैं, इसके ऊपर अब बड़ी रिसेंट साइंटिफिक रिसर्च है कि जो कॉर्टिसोल का लॉन्ग टर्म इफेक्ट है वो क्या करता है. इफ इन केस बहुत देर तक इट्स अ प्रोलॉन्ग्ड स्ट्रेस, आपके अंदर कॉर्टिसोल्स बार बार लाइक दे आर देयर इन यू, लाइक यू आर नॉट एबल टू मेंटेन द इक्विलिब्रियम, तो होता क्या है कि एक टेलोमर्स हमारे अंदर एक है that determines that how long a cell would live. अब इसमें क्या होता है, it is very important to maintain a balance between aging and immunity also. So telomeres क्या करते हैं कि ये shorten होने शुरू हो जाते हैं. Longer the telomere, the better is the cell life, the better is your immunity, the better is your aging process, the better is your memory. बट टेलोमर्स के शॉर्ट होने के कारण क्या हो जाता है, और ये कॉर्टिसोल्स इसको शॉर्टन करते हैं. पॉइंट ओवर हियर इज कि जो टेलोमर्स हैं, अगर इफ इन केस देयर इज एन एक्सेसिव सिक्रीशन ऑफ कॉर्टिसोल और दे रिमेन इन योर ब्लड फॉर अ लॉन्गर टाइम, दे मेक एन इम्पैक्ट ऑन द टेलोमर्स, जो कि आपके इम्यूनिटी के साथ, आपकी एजिंग के साथ, सबके साथ कंसर्न है. इवन कैंसर फॉर्मेशन भी तब होती है अगर टेलोमर्स जो है वो शॉर्टन होने लग जाते हैं. इसीलिए जो कहते हैं कि ओल्ड एज में कैंसर फॉर्मेशन ज्यादा होती है. दैट इज वन रीजन ओवर हियर. सो उसके अलावा क्या होता है, वन function of the cortisol that can be very harmful if in case it remains in our body is that it impacts telomeres, and the second is that it makes the structural changes in the hippocampus area of the brain, जिसकी वजह से क्या होता है, आपके जो डेंड्राइट्स हैं, आपके जो साइनेप्टिक टिश्यूज हैं वो डैमेज होने लगते हैं, जिसकी वजह से आपकी मेमोरी लॉस, जिसे हम न्यूरोजेनेसिस कह देते हैं, वो प्रॉब्लम्स अराइज होने लगती हैं.
Excuse
So
me, ma'am.
this was all about, yes.
Excuse me, ma'am. Sorry to interrupt
Yes.
you. Ma'am, our participants are from all
Yes.
over India and they don't understand Hindi. Some of the participants don't understand
All
Hindi.
right. All right. All right. Okay.
So,
Okay. All right. I'm so sorry. I thought that we have a mixed crowd. That's why I was using Hindi as well, but I'll be totally doing it in English. I'm sorry. I should have asked it beforehand. Okay. Thank you. So do I need to repeat anything, or is this portion okay to you? Sure. All right, I'll just summarize it. That till now, what I have been talking about is that what is stress actually, and what actually, how the body or the biology of us responds to the stress. Like, how does the HPA, that is hypothalamus, pituitary, and adrenal gland are associated, and they act as the feedback loop. Like, it's only through the HPA, that is hypothalamus, pituitary, and adrenal gland, that a particular stress response mechanism is triggered. That is, the cortisols are produced, and then they energize, or they provide an extra energy to the body to have a fight or a flight reaction, or to combat with any kind of a pressure. But at the same time, if the cortisols remain for a very longer time, the body does not reach the equilibrium, what happens? It can affect the immune system. It can affect the changes, that it can even make an impact in the hippocampus area of the brain, right? So this was all about till now that we have covered it. Now then, what happens? As like any one of you can tell me, do you consider stress to be helpful or it is harmful? Do you think that stress is helpful? In what way, if you think that stress is helpful, in what way it is helpful? It's just, like how, like it's from your daily experience, anyone can answer that how stressful you think that how stress is helpful in your daily life. Yes. Okay, what we can do is I can just go on, and in the end we can take with the questions. So
Ma'am,
if in case we talk,
participants are answering through the chat window, ma'am. If you can see.
oh, I see. Okay. All right. All right. Okay.
So I request all the participants that they can unmute and talk to ma'am directly instead of writing in the chat window.
Okay, let me open the chat window. Okay. All right. So if in case we see, yes, to some extent it will help us to achieve goals. Sometime it's make us to work faster, otherwise harmful. That's an exact answer that has to be there for the stress as helpful or harmful. Like stress acts as a protective mechanism that warns us of some kind of danger and protects us in a way that we are prepared to face it. It is a natural reaction that signals us when to run. And this response is referred to as like either you have to fight it or you have to flight. Like yeah, to like either you have to indulge into it, you have to combat with it, or you take a flight. Or then the stress is useful in your survival as well. That is like at the right time, stress increases our awareness and improves our physical performance in short bursts, because whatever like as cortisols or as extra glucose energy is produced in us, it gives us the our metabolism becomes faster, we have the energy, and hence we can combat with it. But it is harmful as well, because if in case it is a long lasting psychological and physical health issue, that can result into depression, it can further result into burnout, right? Or it can in even like whatever psychosomatic health disorders are, like take the example of cardiovascular health disorders, or you take the example of say hypertension. To any doctor you go, you ask that I am suffering from hypertension or my BP is fluctuating, the first question they would ask you is that do you have any tension, do you take too much stress? So that's how it can be harmful as well, and how it can be helpful as well. Now, see, at times we do not even get to know that I'm stressed. So here it is extremely important to understand the symptoms associated with it. Like what are the physical symptoms? Now the physical symptoms are, like for example, the first physical symptom that you would see is that there is a sleep pattern changes. Either you sleep too much or you are sleeping too little. That is the symptom associated with having some kind of stress. There are digestion changes. Like there can be bouts of diarrhea at times. Like there are problems, issues related to your digestive tract. There can be headaches. There can be fatigue. Like you just feel that you're worn out. You're not able to perform as much as you should at your particular age. Then there are aches and pains. Then you are time and again feeling some kind of the infections. Like many children, when they are stressed, they do get the skin infections. They get viral infections time and again, like there's a congestion, or whenever whatever, like whenever there is a stage of stress because of the examinations, or they have to travel anywhere, like they start having these kind, because they are taking too much of stress and the body is responding in that kind of a, like there is always a signal, there is always a siren. So these symptoms, they will help you in understanding that do I need to understand what is happening inside me. So that's why symptoms are very important to be taken care of. Like there can be loss of sexual drive, there can be sweating and trembling, there can be tingling hands and feet, breathlessness, palpitations. Then there are mental symptoms as well. Mental symptoms are lack of concentration, like you're not able to focus at all. There are memory lapses, like you are actually in a lecture, you're actually in a seminar, but then the things are going just beyond you, like you don't not able to get anything. That is because of the lack of concentration. You're not focusing, you're not able to focus. Then there is difficulty in making decisions. Many a times you must have seen it that uh, you're not able to decide that how do I go, should I go or should I not go, how should I consult this book for the lecture preparation or should I consult that book. Like just because of the lack of decision making, you prolong the things, and that again accumulates your stress. There's a lot of confusion, disorientation, and at times there is a total blackout. Just say like at the stage when we call that it is a burnout kind of a stage. Then there can be restlessness, fidgeting. If in case you want to understand that if your child, your companion, or your colleague is in a state of certain stress, you can just observe their behavioral symptoms. The behavioral symptoms could be like eating disorder, is not eating at all, or is eating too much, or has started with the intake of alcohol or any other substance, or there is some kind of the smoking that is taking place, like increased smoking, because these are the behavioral signals that indicate that there is a maladaptive kind of a mechanism that is going on. When somebody is not able to handle a stressful situation, then some kind of the defense mechanisms or some kind of the other behavioral which may be maladaptive in the long term are taken refused, that is being more utilized. There is restlessness. You're not able to rest at all. You're moving around, moving from one corner to another corner. Then there is nail biting. It's a very common symptom in especially children or say teenagers, that they would be biting their nails if in case they're too much stressed. There is then there are emotional symptoms as well, like that they get into fit of rage. You ask a question and you would not understand that why this person is giving me that kind of an answer, like I didn't do anything. Like your parents must have acted in that kind of a situation, or you would see that your child acts at times like that. Why is it? It's a fit of rage, like it's a cumulative stress. That is a symptom which is indicating that something needs to be done, right? There is tearfulness. Like tearfulness is like always you're ready to cry. The person you would feel is about to cry would cry if in case you ask another question. So that is also like when there's a difficulty in coping with the stressors or with the pressures, with the delays or anything that can result into it. Then there is a total deterioration of personal hygiene and appearance. You would lose that interest in taking self-care or hygiene, or even the clothes are not ironed properly, or that signifies that something which the person is not able to manage effectively. Now, the point is that once we understand how we are feeling, it's very, very important to identify the cause. Like out of all these symptoms that we have gone through, like we need to understand at this point that if in case I am having, or somebody else who is very close to me is going through some kind of disorientation, or is going through some kind of the behavioral issues, I need to understand, right? Or you help the other person also to understand that there has to be a cause. So identifying the cause is something extremely important. So it can be the stressor can be acute or it can be chronic. Acute is for a very short duration. It can be just because of some exam that has to happen in the near future. That is an acute kind of a stress, that it just happens for a specific period of time. Like it can be just a domestic help on leave. Like she says that I won't be coming for another 15 days. It can be an acute stress, that what to do, how to handle. There can be some argument with your spouse or with your boss. It can be a traffic jam constantly. These are the examples of the acute stress, that it comes suddenly, but the duration is of the short term. Or there can be a chronic stress. Now, it occurs when the autonomic nervous system doesn't get the chance to activate the relaxation response on the regular basis. Like chronic stress can be that you're living in some kind of a toxic environment when you cannot change the situation, and you have to live in that situation for years together. Now that can become a chronic stress. So the first thing is, till now, I believe that we understand that stress as such is a biological mechanism as well. Now you understand that there are certain symptoms associated with it. If in case we are not able to manage, we are not able to handle it, we are not able to prevent it, then what happens? There can be certain behavioral, malfunctioning, or it can be some kind of the maladaptive coping that we start using. That is in the, reflected in your behavioral symptoms. Okay, so now it is the causes of stress. If we go through it, we basically divide it into two kind of the causes of stress. One can be your internal and the other is the external. What are the internal stresses? Like, you know, it's just yourself who can be more responsible of feeling stress than any other person. That's your lifestyle choices. You choose, like taking a lot of caffeine and then not going to sleep properly, or overloaded schedules that you develop for yourself. That is your lifestyle choices. These are internal stresses. Or there can be negative self-talk. Your internal stressor, this is a very, very important factor in the causation of stress, that how you appraise it. That if in case you are always indulged into a negative self-talk, like a pessimistic kind of a thinking, or you're indulged into a very self-criticism or over-analyzing the situation all the time, you will be more burdened with the stress as compared to the one who is more optimistic. Like, I'll give you an example over here. Like, if in case you prepare some kind of a presentation, and then the boss says, it's okay, but I would appreciate, or I would have liked it if you could have put on these slides as well, this data as well, some other data he refers to. And then when you return, you feel that, oh, I've been always like this. I've worked so hard, but this person would never appreciate what I do. And it always happens with me throughout life. It's like this, that I work so hard, but I'm never rewarded. So this is a typical example of a negative self-talk, which can exasperate your, entire mechanism of dealing with the stress. Otherwise, if in case this would not have been a negative self-talk, rather you would have said that, okay, that's a good idea. I can put up more slides as well. All right, I'm ready for the presentation. Now, what happens if in case you're indulging into negative self-talk, it would affect further your presentation skills as well. So many a times, whatever it is, we at times are conditioned because of the parenting style, because of the environment, or maybe because of our own personality type, that we cannot restrict ourselves from pessimistic kind of thinking, or always indulging into self-criticism, like nothing good happens to me. I'll not be able to, I'll never get a dream job that I want. I'll never lead to this kind of a position. So it's a kind of being always in a state of regret. It's always in a state of like, not being happy in life. Then there are mind traps also that you use. This is also a cause of internal stressor. Mind trap is unrealistic expectations. Like, like at home also, in your family, what happens, like you expect a lot from your spouse. Like if in case both of you are working, maybe a female or a, like it's in both the cases, like you expect that the other person should ask first that how are you feeling, and you keep on waiting. That is your expectation. So if in case you have too many unrealistic expectations, you have your children and you expect your children to top in the class or to always be first in everything, in all the activities, these are very unrealistic expectations. So such unrealistic expectations and not being connected to the reality, or not understanding that too much of expectation is going to, lead to only the stress between the relationships also. Then taking the things personally, like you go to a workplace, you wish somebody and the other person may be busy in something else and didn't even observe that you wished, but internally you're feeling that this person has a problem with me, this person is definitely annoyed with me. So this is like you just involve yourself. At times, we are brought up like this, or we are too sensitive. We have not understood that if in case that that could be another person's problem as well. We never understand. There are a number of examples. Like, I'll give you an example of yesterday only. Like, I am the in charge of the college these days. So I deputed the people for the preparation of the youth festivals. This is just an example that how taking things personally can make an impact. So the people who are the youth coordinators, they made the list of the duties. They circulated it. Nobody had the problem. The other day, one individual, he was a guest faculty, had come and said that, this is not done, this is not right. These people have issues with me. That is why they haven't kept me in the category of folk singing or something, and they have just given me one item preparation because they have problem. All right, I said, okay, relax, take it easy. Let me call the coordinator. Let me call the convener of that item. When I called the convener of the item, I asked that, did you tell the coordinator, youth coordinators, to put his name in that kind of the item, in that folk song? They said, the person said, no. I thought that I don't need him to be in that category. So he was, because of his personal grievances, he was just attacking the youth coordinator, and he was not able to see through that there can be somebody else also in between, or not able to see the situation holistically, just because you just drive the conclusions. You have certain preconceived notions. We have the preconceived notion. Example, like I if in case talk about it, we have certain preconceived notions that mother-in-laws are like this. They would never understand. A mother-in-law can never be a mother. Now, these preconceived notions, or they actually have prepared us to, to take the stress of everything, to take the things in a very different way. So this is a mind trap. These are the internal stresses. Like, there's nothing like this, but we get into these internal traps just because of our own kind of the negative self-talk, or our own choices, or our own rigid thinking, or just exaggeration of the things. Like, how could he talk like this? Or he said this thing to me pointing at me. He did not name, but he's pointing at me. We are just, that's how the mind trap works and puts us into the more of the stress. Like, we receive just the unwanted stress also, which we could have handled the other way out. Then there are personality traits. Take the example. There are people who are perfectionists. There are people who are workaholics. It has been observed that these kind of the personalities, they take a lot of stress. Perfectionist people or workaholic people. Why? Because they would keep on working. That's a good thing also, because they are more creative, and then they would want to give the best to the world or whatever. But otherwise, they are taking the stress, which otherwise could have been managed in a different way. Then there are external stresses. Now, any idea what do I mean by external stresses? These internal stresses means that they arise out of you. You yourself somewhere are causing that kind of a stress. That is why it is known as a internal stressor. That it can be your thinking, it can be your personality, it can be your preconceived notions about somebody, it can be like say some kind of your expectations, unrealistic expectations. So these are your internal, they arise out of your own self. Then now, what are external stresses? Any idea about the external stresses? Yes, any idea about the external stresses?
Would it be like traveling to the workplace, the traffic around us, and we have to reach in time?
Yes, exactly. Exactly. That's what the external pressures are. That is, it can be our physical environment, it can be a lot of noise, or it can be at times like, you know, there's some DJ party going on. It can be bright lights. It can be, say, the weather. It can be the confined spaces, the workspace that you are getting up. Like the area where you work is too much crowded, or there can be some kind of say organizational stress that can bother you. So these are the external stresses that are there in the environment. And then they can be your major life events as well, because they happen externally. Because of that, you get stressed. Now, the major life events can be the birth of someone in the family, or they can be, you know, the death in the family. It can be the lost job. It can be promotion. It can be your marital status change, or the daily hassles like your spouse or your children, they are not organized and they misplace the keys all the time. Or there can be some mechanical breakdown, like your washing machine abruptly halts, or your car is not working. So these are all kind of the external stresses. That then this can be the so the behavior of another person as well. That can be the social interaction or the rudeness of your spouse. It can be the aggressiveness of the people around you, bullying behavior, or it can be altogether the organizational stress. It can be the regulations, the deadlines, the bossiness at the workplace. Then there can be lack of job security. There can be a feeling of unfairness. It can be like too much of autocratic kind of the environment at workplace, and the poor quality of supervision that you're receiving, little or no control over workplace activities. So these are the external stresses, right? So till now you understand that we have two set of stresses. One is internal stresses, that is your own way of thinking, your life choices, your decision making, how you make your decisions, how you're trained to make the decisions, how often you get into the mind traps, what kind of expectations you have from others. And then there are external stresses, which are again internal stresses. Up to some extent we can manage if in case we get some kind of the therapy sessions, the counseling sessions. But external stresses at times, just like for example I mentioned that there can be say the death in the family, the bereavement period in the family, or it can be the loss of a job, or a big financial loss, or some catastrophic event that has happened. So these are not in our hands, right? And then the workplace stress, at times constantly you are in that kind of a stressful workplace, that can also lead to a burnout kind of a thing. Now we have a questionnaire that I want to share with you. Like, let me see if in case, or otherwise I can just ask you to write a few things. Just a second. Okay, so the questionnaire is, describe your largest source of stress, like in the moment, like anything which you feel is been stressful to you over the 4 weeks period or over a long period of time. Just, like anything that you feel that you perceive. It can be your family life. It's up to you only. You're not sharing it with me, you're not sharing with the other participants, but just for your own understanding, just you have to be aware of it, that what is the largest source of stress in your life at the moment. And then you have to list 2 other stressors, just 2 other stresses you are experiencing. Any 2 stresses. It can be external stress, it can be internal stressor. Anything that you're experiencing. Maybe that can be related to your traveling part, or it can be related to your relationship aspect. Anything. Both of them can be internal, both of them can be external stresses. But just, for your awareness, you need to write it. All right. Are you done with this part? Have you been able to identify the stresses you're experiencing? Yes. Have you been able to identify the stresses that any major stress that you're going through or you've gone through in the recent times? And then 2 more stresses. 1 major stressor and then 2 more stressors that can be your internal stressor, or that can be your external stressor, anything. All right, I am getting the responses that you have been able to identify. All right, wonderful. So now the next aspect is, just, you have to, if you have a paper and a pencil, you just have to, put a tick, or you just have to write as 1, 2. I'll just speak out the symptoms that you have experienced in response to stress. You just have to count how many symptoms you have received, or sorry, how many symptoms you have experienced. Like anger, frustration, that's 1. Anger or frustration, most of the times, if you've been experiencing anger or frustration. Next is fatigue, like, that not even working much physically, but you're always feeling fatigued. Always you feel that you're not in that kind of an energy state. You're not in that vigor. All right. Then the third one is nail biting. Do you just start biting your nails whenever you get the time, or you just have that tendency to do it? Then do you feel socially withdrawn at times, like you don't want to participate in certain activities, you don't want to go? If somebody invites you, you put up a lame excuse that I'm not well, I won't be able to come. Most of the times, sometimes it happens that we don't want to participate, we don't want to go because of our other commitments or something. But is it that you feel that you're socially withdrawn, like you don't want to, despite you are preparing yourself, but most of the times you don't want to participate in social kind of the gatherings? Then the 5th one is, do you get anxiety at times, and especially in the evenings or on the Sundays, that you feel more anxious? In the sense, like, anxiety is basically the palpitations in your heart, You feel nervousness. Then next is, after anxiety or nervousness, next symptom is headaches. How often do you get headaches? Like you are taking pills or something time and again. You are complaining of the headache, that I have a headache all the time. Then the next is, seventh symptom over here is over or under eating. Are you just, there are phases that you just want to go on eating, like, right? You're not able to control yourself. Like, although you're eating a lot at night time, also in the morning also, like you're always munching something, or you're not eating at all. You're skipping your breakfast, then you're not taking your lunch properly, you're missing your evening snacks or something. Is it that there is a decreased sexual drive in you, that you don't feel that kind of a love or affection for your partner? Then the next one is that, do you get that indigestion most of the times? Like whenever after every, say, 15-20 days, you complain of either constipation, or you complain of diarrhea, or you complain of some kind of burning sensation, or that thing, like, do you often feel that indigestion? Do you indulge into procrastination? Then the next is, do you worry a lot? Are you using any kind of, say, like the smoking or alcohol use too much? You think that it's way beyond the normal drinking or smoking? Do you feel that muscle tension, like you feel that your muscles are not relaxed? Do you find difficulty in sleeping? All right. So out of these almost 15-16 symptoms, you have to tell me honestly, just put the number in the box. How many of you have reported more than 5 symptoms? How many of you have reported more than 5 symptoms? Anyone who has reported more than 5 symptoms? All right. All right. So see, now this is the point. This is okay. All right. All right. So till now, you understand, whosoever. Now this was the first step for the self-realization. Now stress, it's all about the entire thing is that stress is inevitable. It has to be there in your everyday life. But the most important aspect is how to manage it or how to prevent it. Like, there are individual differences. Again, I'm telling you that what would make an impact is that how you perceive it, how you internally have a talk about it, or like how you have been trained to handle it. But the good news is that any time in your life, the stress management techniques can be learned, right? That is why I tell you one thing, why any kind of the spiritual leaders, or you may talk about Eckhart Tolle, or you may talk about Sadhguru, or you may talk about say Maheshwari, like why they are getting so much of relevance in today's world is because they actually tend to provide you, or they try to bring the change in your own self. We cannot change the environment. We cannot change anything around us. The only thing we can change is our own self to manage it, to manage the things in a better way. So the first aspect for stress management, the first step for stress management is that we need to understand your stress, and we need to first of all identify our stresses. You have identified your stresses. You know what is stressing you, what is the source of stress, and how much is it affecting you. So these are the two aspects before we start on with the stress management. Then that is there are two major kind of the approaches that we'll be talking about. One is the action oriented approach. Like we need to take an action to change a stressful situation. Take an example. Like how many of you are assertive? How many of you can really assert in your relationships or at your job? Have you learned to be assertive? Yes. How many of us are assertive in the group? I hope you understand that, you know, that's a basic communication skill that is required to be assertive or to be passive or to be aggressive. Now, assertiveness skill is that if you want to say something, you're able to say that without hurting another person's emotions or without damaging another person's self-esteem. You keep your self-esteem as a priority, but you do not let another person also be damaged. That is assertive skills. That is just, you know, you're at the middle of something and your colleague says that since you're my best friend or whatever, can you please do this thing for me? You leave your work and you start doing her work. And then the boss comes and yells at you that how could you do that? You have not finished your work at the time and this and that. Over here, your assertive skill was to take a role. Like you could have told your colleague, you could have told your friend that, see, I have to finish this aspect first and then I can help you out. That should have been the assertive skills that you need to use it. So being assertive gives you a win-win kind of a situation. That is, you are able to protect yourself as well and you are able to maintain the relationship. When we don't say the things that are required to be said, that, you know, results into some kind of a chaos in a relationship. So the participants, you are requested to start using assertive skills in any of the relationship. Just say what you feel. Just tell the other person how you want. If your boss calls you and tells you that, you know, you have to finish this by tomorrow, you just say, you negotiate and be assertive and say this thing that, yes, sir, this part I'll be able to do it. And the rest, I assure you that will be done in 2 days' time. You have to ask for it. You're a human being, right? You know your skills. You know your, provided you're 100% honest, right? You're giving your best. So if in case you are assertive at that point, you are winning the situation. You are able to give your best because you have taken the time also, and then you would put your best to give the results in that given time. Then you have to learn to manage your time. Many a times what happens, the stress around us is because we are not able to manage our time. You have to understand that just wasting the time sitting somewhere just chatting on phone or using too much of the screen time or doing certain activities which we are not even aware of, we are at times addicted to some kind of a behavior. We waste so much. You have to identify the time wasters. Everybody has got that 24 hours span. Some people are able to manage those 24 hours. Some people are not able to manage. So one of the most important, crucial stress management strategies that you have to understand, what are your time wasters in your life? where you're spending a lot of time. You have to make a plan accordingly. If in case you find that you're wasting a lot of time on one particular activity and you're ignoring the rest of them, then also you will be under stress. So you have to divide, you have to make a fine balance, you have to make a wheel out of it. See, work life balance also you have to create. How much work is work, like how much time are you giving to the work, and then how much you are giving to your family, to your life. So these things should not be mixed. Whenever, if we put the work in a family or our family into the work, there is always a chaos, there is always a stress. So one of the strategies is that when you are at the work, stop thinking about the family. You just have to block it. I just have to, like, that's how you can actually be present at the moment. You would be able to give your best. While you're at that moment, at that point, then only you will be able to make the decisions, you'll be able to increase your productivity. But if in case you have a backlog, you have a kind of a too much of stress in your mind related to your family affairs, some other things going on, then there are more chances that you will make errors also at the workplace. You would take more time, and hence it would be a reason of stress. Then next is that when you make a work-life balance, make sure that in the family also you don't take work along. While you are in the family, you're just talking about the work. My boss said this thing, my colleague did this thing. So what's happening? What's happening? Actually, we are confused with like what to do at what point, and we are making a sandwich out of our life, right? It has to be segregated. It has to be, finally, you have to be aware of it, because as I gave you the example in the beginning, that a small kid had come to me and said that, "Auntie, I'm really stressed. I have a lot of stress." I said, "What stress?" "I have a stress because my mom, when she comes from the workplace, she tells me that she's stressed. My dad is in a business. He comes back home and he says that he's stressed, and everything gives me the stress." Like, what is it? So when your environment, your children, your family time should be guarded. You have to keep these things away. You may not be consciously doing it. You are not even aware of it, that what you're doing it on the table. But this is transferring the stress. You're bringing the stress home. Then home environment is stressed. So the best strategy is that you have to make a work-life balance. Keep the work at the workplace, the life at the life place. Of course, you can discuss important aspects with your spouse, but make sure that you do not go way beyond that. All right. Make sure that the wheels are balanced. Neither the life like this, like your family life is like this, and you're not giving due importance to the work, then you cannot expect timely promotions. You cannot expect something, bonuses or anything like that. But if in case, and similarly, if in case you're giving too much of weightage to the work, some aspect of the family will be missing. So the best thing is that the why there's a 5-day work ethics in Europe or in Australia or abroad. They strictly follow work-life balance, that if you've worked for 5 days, then the total 2 days are for the family. They spend vacation with their family. They're totally for the family. They would do the cleaning themselves. They would be with the kids. They would take them out. Then they don't talk about the work life, because that's how the rejuvenation would take place. So work should not be overwhelming, right? It should not be overwhelming at your workplace, that even the kids, they start feeling the pressure of being some kind of a stress in the home environment. Then avoid multitasking. Many of us, especially women, we are very good at multitasking. Men are not. But if in case we constantly indulge into multitasking behavior, and we are expecting to give the best in everything, then that is also taking a toll on us. As initially I mentioned, that there is a biological response. The stress puts a biological action. There's a feedback reaction. So if in case your body is not coming into the rest because of one activity and then other activity and then getting into another activity, there should be the clear periods of relaxation as well, right? Then you have to create boundaries in your relationship also. You have to create space. So during this COVID, during this pandemic, why there's been so much of domestic violence? Because somewhere the boundaries or somewhere the say the spaces have been too much of intrusion has happened, like too much of expectation from one person or of the entire family has happened. So you have to create boundaries for everybody. If you keep doing the things for others, they would keep expecting more and more. So you are the one who has to create a boundary that, yes, kiddo, that's what I can do with for you. Now this is your task as well. You set a boundary. Keep your time available for yourself. Out of 24 hours, give some time to work, give some time to family, but you must have your own time, my space. That has to be created by you only. That is through time management, but and also by setting the boundaries around you. Then, of course, as I've already stressed upon it, you have to minimize the stress of working environment. You don't have to carry that stress, and then assertively avoiding the stress at the workplace also, at the family level also. That will, give you a kind of an action-oriented approach. Like you have segregated, you have pointed the stresses of your own, you know your symptoms. Now you have to work on this, whether an action oriented approach will work on it or there has to be some other approach to deal with it. So the action approach would require something that you can do to make a difference. That can be by setting the boundaries, that can be by your time management ability, that can be by keeping your workplace and family life balance, then or by being more assertive, telling the things that you can do and not able to do at the time, or just giving your mind. See, it's extremely important to communicate. We are stressed at times because we do not communicate. You will not go to your kids and tell that, see, I'm too much stressed. We really need to distribute. We need to have a teamwork. Or you will not go to your spouse and say that I need your help and let's start doing it. So you have to speak your mind for your own self. The change will not come automatically. The change will come only if in case you start asserting, you start making the boundaries, you start keeping your priorities, that what all you have to do and how you have to do it, by setting up a priority wheel. Or if this priority wheel has to be made up according to the developmental stage of your life. Now the priority wheel cannot be same all through. Like at times, priority is your work in the initial years when you're not even married, you're making your life. Then the priority may be your work. Like you want to gain, some credentials, you want to engage into some other learning activities, you want to gain some experience, you want to build up the confidence, you learn like taking up certain courses to build your competence. So this is an action-oriented approach, keeping in view the priorities in your life. Then a time comes when you become a parent, then you must prioritize according to the role. Like the first, what the psychologist suggests, that the wheel should be balanced of your life. Those priorities have to be taken into account. Because if in case when the kids are very, very small and you're too much pressing yourself for the work, at that point, your kids' developmental process may affect, and then there can be behavioral issues in children, and then those behavioral issues will be the long-term source of stress for you. So what is required is that you prioritize. That if in case you have priority as your work, or you have parents later on, when you're in your mid-40s, your parents become your priority, that you have to take care of them. You have to take them to the doctors. The appointments should be scheduled. When you're in your, say, 30s, early 30s, you have kids. You need to take care of your kids. The appointments should be fixed. The schooling should be fixed. The quality time should be fixed, that this is the quality time that I have to spend with children. And that's how, you can have the action oriented kind of a strategies. Then the next aspect, these were the action oriented strategies, that is by managing your life choices, by changing some work environment or home environment, by asserting yourself. Now, then there are certain emotion-oriented approaches also. For example, nothing works. Stress is stress. What can be done? How can you manage through emotion-oriented approaches? One approach that is very, very popular is the affirmation and imagery. Affirmation, why affirmation? What are affirmations? Any idea what are affirmations? What are positive affirmations?
Speaking only in positive sentences, like rather than I cannot do it, say I'm happy, or this is what I have heard.
Yes, absolutely. Absolutely. Very well said. Then affirmations should be like in the present form only. It should not be that I will be happy. It is I am happy, as you said, that you have to make very positive affirmations that yes, I can handle, I will handle. And then you can handle as well. If in case you start your tackling of the stress by saying, let me see, it is too much, I don't know, I don't have the confidence if I'll be able to do it. So you have to have the affirmations with you all the time, depending, but it is extremely important that you keep building your skills to handle it. Take the example of the workplace. There are certain skills that you really need to acquire from time to time. And if in case you are able to acquire those skills, you become more positively affirmative, because then you're more sure about yourself as well, right? Then next is like imagery. Now, what is imagery? Visual imagery. Anyone who has ever tried it? Visual imagery, just for the relaxation purposes? Anyone who has taken up this strategy for relaxation purposes? Visual imagery? You all are from the computer faculty, right? You're from the computers department, and you believe in artificial intelligence. Not you believe, like, of course there is artificial intelligence. Like, you do certain kind of the programmings, you do certain kind of the virtual kind of the thing, right? In psychology, this visual imagery plays an extremely important role in relieving a person's stress. How to do it? I'll just give you an example. You can try it yourself. That is, what does it mean by, yes. All right. Visual imagery is basically that you just imagine yourself while you're in a state of relaxation. First of all, you have to put your body at relaxation. You just relax yourself, like your muscles. You just put yourself into that relaxation stage. And then you take 3 breaths, 3-4 breaths, deep inhaling, exhaling, inhaling, exhaling, and forget about the past, forget about the future. Just start visually imagining whatever you want to imagine. Like, say, for example, my best place, like I've been visiting a lot to Kasoli. This is a very close to the area where I reside. Kasoli is a hill station. So whenever you're in a state of stress, you just have to relax your body. Just have to visually imagine a place which is of your choice, which is a dream choice, a dream vacation for you. That can be slowly take yourself in that imagery to that place. It is so strong at times that you would start observing, or you would start having the sensation of those colors. Like, what do you want to see? You want to go near the beach, you want to go near the hills, you want to listen to the waterfall. So that's how you would relax yourself, that visually you take yourself to the place which can soothe you, which you've been longing to go to, right? So you visit that place for 5 minutes, for 10 minutes, and then have a better awareness through visual imagery of the sound, of the colors, of the fragrance you want to have, of the person you want to go with along, right? So you just have to create that kind of an environment. You can actually experience a lot of stress relaxation while practicing this thing. You can do it anytime, and you will feel that it has really made an impact. Then the next is ABC technique. What is ABC technique? ABC is basically a stress management technique related to emotion-oriented approach. This is there's a Martin Seligman, who is you can say, a positive thinker, a positive psychologist, who has done a lot of work on learned optimism, right? So this model is developed on that aspect, ABC. That is adversity, belief, and consequence. A stands for adversity, B stands for belief, and C stands for consequence. Adversity is like anything, any stressor which creates a pressure on you. Any event, how we think about the event, that would create the belief. Like, for example, there's a change in the government, or for example, there's a change in some law or whatever. How you are perceiving that change, it's an immediate stress on you, or the change in your work hours, or the change in say some kind of the residence. So that comes as a stressor. That's taken up as an adversity. That's taken up as a preparation for some kind of a coping mechanism. So the key point occurs between adversity and belief. Like the most important aspect is the distance between how you receive that stressor, between forming a belief, like how you take it, how you receive it. That is, when you encounter adversity, how you tend to explain it to yourself directly impacts your mindset and your relationships. It's exactly your explanatory style, It is the habit that influences your entire outlook on life, entire outlook, how you're explaining it. For example, see, your kid might have got less marks in one particular semester. And that's a major source of adversity for the parents these days. How come? Why? But if in case now that result between you and your belief that there is some reason behind it, it's okay, I need to understand my child. Like, I have to go through that. Maybe the subject is difficult, or maybe he's not able to understand. Maybe he's interested in some other subject. Now that belief within yourself will influence the consequences, will influence your entire coping mechanism, will influence your entire stress management. If in case we just do not think about it, we just say that, okay, this thing has happened, and you call your child, you shout at him, and then you tell him that you are into your room, you're not taking up any other activity, till by the next semester you are able to improve. Your say playground hours are reduced, your everything is reduced, your friend circle is reduced because you're not able to perform well. I'll not tolerate it, and hence you react that way. That's one way. But if in case while receiving it, and what belief system you form, how you take it, that I need to understand my child, I need to understand where the problem is, I need to give space to my child to explain, and then we need to together work out on the problem. Now this is how, like, that would influence the consequences, that then the child would also open up. Many times children say that, yes, I understand that I didn't do well, and the reason has been that I've not been able to understand this particular unit, and I would appreciate if in case I can get additional hours on this thing. Sorry. So the consequences are dependent upon your belief, that how you take that adversity. Like, for example, COVID had come. It came as an adversity. Like, altogether, the entire system changed. Altogether, we were put inside the homes, right? We were said that the working system changed, the relationships changed. But how some people took it? They took it as an opportunity. They believe that this is the time that I have got the best time to utilize in doing the things which I was not able to do it earlier. And then the consequences that they were able to improve their health. On the contrary, some people said that, oh God, what is this COVID? This thing has happened all of a sudden. I'm not able to go out, how long it is going to take it. And that affected their immune system. Many of the cases you must have seen, like how you take your illness. For example, take the case of Yuvraj Singh. How did he take his illness? Like, he dealt with it in a very bold way, that, okay, cancer has happened to me, but I will fight it out. I will raise my immune system up to the level that I will be able to come back to the playground, right? So how you take the things, that's how I think that all of you must have gone through say Oprah Winfrey's story. If in case you remember how Oprah Winfrey, what kind of a childhood she had gone through, what kind of the adversity she had gone through. She became pregnant while she was a teenager. She had a very tragic childhood, but that adversity and her belief system, she believed in this thing, that only I can change my situation. I want to become something so that I am more respectful, right? So that is how you have to learn the optimism. You have to instill that optimism in your children also, that adversity again is inevitable, that will keep on coming, but how you deal with it is, that is entirely up to you, that how you take it. At times, many times, the relationship issues come to me. There are a number of stresses, that mother-in-law and daughter-in-law, they have a fight, and then there is a chaos in the family. If one of them takes the person, if one of them understands that, okay, if she is saying this thing, I need to understand, I believe in this thing, that nobody is good or bad, it's just, maybe the time or maybe the circumstances that somebody is saying something. All right, I'll explain it to her. Then the entire consequential behavior will be different. I hope you understand that this, like, whenever there is a stressor, when it affects you, there is a time between that when you really have to decide what you have to do. what kind of a belief system you need to formulate with respect to the stressor. So take your time, just a few seconds, that I just repeat it to yourself that I need to handle and I can handle in a more positive way, right? There's nothing which cannot be handled, which cannot be managed. And then I'm sure, I assure you, your management technique would be very different. The consequences would be very different because you are engaged into some kind of the optimistic strategy that can be taken care of. Then, of course, as I said, that most of the issues that come up are because of your cognitions. You have to do the cognitive restructuring. You have to, like I again say that many a times I say that I can never be successful. Like, I'm unlucky. Whenever I try, I never get the job. Or that's how we are indulging into. So that also has to be tapped. Basically, it's a very simple process that whenever a negative thought about yourself, about you're getting too much about, it is very good to know about your strengths, your weaknesses, a realistic view. But too much negating yourself, too much into your own self, to your own criticism will definitely have a compound effect of the stress. So what is required is that you restructure that, okay, if in case I have not been able to get this post, or if in case I have not been able to get this position, maybe next time I need to prepare this thing as well. I will try in a much better, in a much more prepared manner. I need to study more. I need to hone my skills more. So it's not always about self-pity. Don't get into, we enjoy it. It's again a conditioned kind of a behavior. We all at times, like, we want to get into that kind of a melancholy. We all enjoy at times talking about say small things about our own self, that nobody loves me, I've never been understood, I'm the most misunderstood personality, whatever I say the person will not understand. So you have to restructure it. Please don't do this injustice to your own self. You have to tap yourself. You simply put a rubber on your wrist, and whenever there is a negative self-talk, you can just pinch it. You can just, let it go and hit you and stop it over there and say, no, the things will improve. The things are improving. It's me who is the best. Like, I've been doing the best all through. And being in gratitude definitely helps us to combat with some kind of the stress. Apart from that, at times there are things that we can change. There are situations we can change. We can change the job. If in case it's very, very stressful and we are very unhappy, we can change the situation. And at times we can change our thought process also. Now I would talk about certain techniques that we all need to follow for the prevention and management of the stress, right? Shall I proceed? Is there any question related to whatever we have done so far? Is it understandable? Yes? Any question? I'll quickly go through another one or two points that I need to elaborate. Then we have relaxation.
Questions are in chat window. Please, if you can go through the chat window.
Yes, I have opened it.
Okay. So
there is only like, can you repeat what does it mean by visual imagery? The rest, there is there's no other input.
Okay. Okay.
Yeah.
Why don't you have explained the visual imagery? You have already covered that part.
Yeah, I have explained it.
Okay.
Shall I proceed? Yes, please, participants, please feel free to say whatever you want to. You want to ask anything, you want to get some elaboration on any point, we can go on with it. or I just finish it off and then we have the question answer session? Yes? I really need your feedback. Otherwise, I would feel that this is a afternoon nap time and everybody has gone to sleep.
Good afternoon, ma'am.
Good afternoon.
Ma'am, what to do if we are not feeling a good sleep, or you can say if we are in stress, then in most of the time we are not feeling good, or we are not taking the quality sleep. So what to do in that scenario?
Yes, it is very, very important. As it has been mentioned earlier, that we have to identify our stressors. What is actually stressing you? You need to talk about it in detail, because at times just the catharsis of the thing relieves you. You need to have a heart-to-heart communication with someone, that what's actually bothering you. You need to vent out. You need to communicate that what are your stresses and how you can help yourself. Now, most of the time, what is happening these days, that after work, either we are too high on caffeine, we take a lot of coffee, or we take Red Bull, or we take like whatever. At times we are taking up these kind of the caffeinated drinks, or we are too much on the internet, or we these things, they make our neurons hyperactive, and they do not get back to sleep, or they do not get back to rest. So what is required at the moment is, make sure that you take time for yourself. You go for the evening walk, because walk relaxes you, it distracts you. Any kind of a distraction, maybe any walk, maybe yoga, maybe any kind of a dance, or maybe anything but the physical workout. It is very important to do a little bit. Most of the times we say that I'm already tired, I'm fatigued, I can't do any gym, or I can't do any walk or anything. That's a myth. That's a myth. Because actually workout or any kind of a physical activity releases dopamine, and dopamine balances your mood state. It helps you. If in case then also there is a difficulty in sleeping, what I suggest you is that you start taking some kind of a calming tea at night before bed. That is, make sure that you eat by 7:30 or 8. Do not eat after that. And check on your diet also, that you're not taking too high salts, sodium, or you're taking too much of sugar, because that also keeps us hyperactive. And then you have to watch on, like before going to sleep, you do not take tea. You don't take any tea or coffee. Rather, you can take chamomile or any kind of the soothing kind of the teas you can have. And make sure that you relax your own self, that we have the points over here. And it has been found that if you start pressing all the tips of the fingers as well as the thumb 5-10 minutes before the sleep, it will put you to good sleep. Then you all, those who are not able to take a good sleep just because of the stress, just warm this coconut oil, put it on your this wrist and the palms of your feet, and then massage it gently, and just near the ears also. These are the relaxation points. What happens in a state of stress? Your muscles are stressed too. So this will help you to relax down, right? So try doing these things as well. And plus, I have a Jacob's progressive muscle relaxation strategy also, that I'll be sharing with you after this. And you will, if you do that, you will feel that you are able to feel it. You'll have the feedback that your muscles are relaxed. You're more at a relaxed state. And yes, don't forget to have that wit and humor in your life. Yes? Yes?
Thank you, ma'am.
All right. Yes. All right. Shall I continue with the next one? I'm not able to. Can you please mute? Can you please mute? Hello, can you please mute your mic, everyone, so that we can quickly finish it off? All right, thank you. So then, of course, like as I mentioned it, like you have to build resilience within yourself. You have to have the resilience. What is resilience? Now, resilience is something that helps you to have a positive outlook towards life, that helps you to have the confidence to handle the things. Many times, just because we lack the confidence, we get stressed. I won't be able to manage. That gives us the stress. So talk it out. You need to have music or dance therapy sessions, or you need to everybody, it's a request that we need to have mindfulness for 5 minutes every day. What is mindfulness? It's just a conscious breathing. You just have to consciously breathe. How many of you give 5 minutes to yourself in conscious state? Well, like just getting into that breathing, just being aware, like just do it right away. How many of you can understand that when you breathe in and breathe out slowly, how you feel it? Just close your eyes and breathe in, slowly breathe out. And feel that aspect within your body, the comfort. That is the mindfulness, the first step, that you're consciously breathing, right? And then gradually increase it up to the self-awareness level, right? Then say, I would want you to, I don't know if in case, let me try if in case I can share this link now. All right, we all need to, all right, I'll put the link here in the message box. We can all switch it on and because I'm not able to share it. I don't know what is the reason. Maybe the internet is too slow. Share the, because it's okay. Let me share it and we all do it together. We do it for a few seconds and then you can later on, that is the Jacobs progressive muscle relaxation.
Ma'am, your screen is not there.
Yeah, I'm not able to share it. I'll just share the link with you. Let me share the link. I'll share it in the message box, right? Can you hear it?
Yes, ma'am, we can hear you. We can hear you.
Okay.
Are you playing some audio file?
Yeah. Is it audible?
No, ma'am, it is not audible.
All right. Okay. All right. All right.
It will be audible only if you share it. Otherwise, it will not be audible.
Just a second.
Or you can send the file to me so that I can play from my end.
All right. Just a second. Just a second. I'm sharing it.
Sure, ma'am. You can try to share your screen again.
Yes. Yes.
Maybe
yes.
this time.
Hmm. Yes. I'm sharing the link in this. Did you get the link?
Yes, ma'am. We have the link.
Yes. You can just see how it is to be done.
hold, and focus on what that tension feels like to you. Now, breathe out and release all the tension in the fist. Let your hand become nice and loose. Again, make a tight fist with the right hand and hold it. Then, let the tension and the hand relax fully. Focus on what your hand feels like to you when it is relaxed. Next, slowly breathe in and bring your right forearm up to your shoulder and tighten your upper arm. Hold. Now, breathe out and release. Again, make a muscle with your right arm. Hold and focus on what the tension feels like in your upper arm. Now, breathe out slowly and relax your arm. Breathe in, and now make a tight fist with your left hand. Hold the tension. Exhale and release. Let the tightness and discomfort flow all the way out of your hand. Again, make a tight fist with your left hand and hold. Exhale and release. Breathe in again and bring the left forearm up to your shoulder to make a muscle. Hold and focus on the tension in your arm. Slowly breathe out and release. Notice how that feels. Again, make a muscle with your left arm and hold it there. Now exhale and release. Now take a long breath in and raise your eyebrows as high as they will go. Hold. Exhale and release, letting relaxation smooth across your forehead. Breathe in again and raise your eyebrows as high as they will go. Hold. Release and breathe out slowly. Next, squeeze your eyes tightly shut. Make a tight smile. Notice how that tension feels. Breathe out and release, relaxing your eyes and cheeks.
Okay, sir. So can we just like, this is just a, like you all can note it down, the link, and you have to practice it of your own every day. It's basically relaxing your each and every muscle of your body. You can do it any time of the day and at any position. Like you can just do it in the morning, or you can do it in the evening, whenever you want to do it. The purpose is that you basically relax each and every muscle, and you feel when you would do it, because I have done it experimentally also. We did this muscle relaxation strategy with hypertension patients, and it was found that like 4 to 5 systolic pressure was reduced, like it was in the normal range. If in case it was like at least 5 points were reduced in that hypertension case after practicing this, just the JPMR, right? So this is a Jacobson's progressive muscle relaxation strategy. It's a very simple strategy which can help you to relieve your tension, to relieve your stress that you feel it every day in your shoulders, in your head, in your eyes. And then with this, gradually start with the affirmations also. Start telling yourself, start making your mini me, going into yourself and thanking every portion of your body, that thank you for supporting me. I'm feeling so good. Thank you. The entire system is beautiful. I'm feeling energetic. That way, this can also help. So before we wind up, there's another important thing that you need to do is, like, please write it down in your notebook that any 3 people you can turn for support in case of any stressful situation. Maybe it is any adversity, any kind of problem that can come up, emotional issue, or it can be any say environmental stressor. Name any 2 or 3 people in your life to whom you can just go for the support. And also write that how sure are you that they can help you. How can they help you? By giving you the emotional support or the financial support or the like anything. So you just have to mention 3 people in your life that are there for your support. Now you have to see that how can you use your social support to manage the stresses that you have faced in the past or you're going through. Can your family, any one of your best friend, and if you do not have that, it is very important for you to have sessions with the counselor, because those who do not have the social support, they at times, they get that kind of a burnout when you're not talking out, when you're not venting out, you're not getting a kind of a direction. Then you need to turn to a psychologist or you need to turn to a counselor if you do not find any kind of a social support network. And to fight with any kind of adversity, the most important aspect is that you need to be very, very sure about your emotional or your financial or your any kind of a supporter that can help you, right? Then next is that whenever you are faced with unpleasant emotions, do you have any habits or tendencies that worsen the situation? Like, for example, I had a case for the counseling. When the lady gets into stress, she stops eating. Like, whenever she has that anger, out of her anger reaction, she tells her spouse, she tells her husband, I'm on hunger strike, like I'm not eating. And when she's not eating, that stress level goes up very high. And then finally it results into a huge fight. Now, what you have to identify, you have to see that are you in a tendency of throwing some such kind of the behavioral things if in case you are in a kind of a stressful situation. Please identify. And then the last one is you have to identify when in the past you have successfully been able to deal with some stressor of your own, and you're very, uh, happy about it that you have been able to deal with it. So these are for your references. These are for your notes that you need to understand that at times you have been able to make it also. At times you are not able to make it because you have certain tendencies, certain habits which come in your way, right? So this was just a reflection for your own self that if in case we have to prevent stress or we have to manage stress, there are a few options available to us. The first thing is that we do not let stress overwhelm us. We have certain lifestyle choices. We get into exercise mode, we get into good eating habits, we get into social interactions, or we have a healthy lifestyle choices. Secondly is, if in case we are stressed, we need to identify if there are internal stresses that is culminating the stress, or they are the external stresses. Whether I am holding the cup for too long, full of stress, because if in case I'm holding a cup for too long, it has become very chronic. I'll just collapse. I won't be able to. How much heavy it is, I can hold it for some time. But if in case a cup is heavy and I have to hold it on for days together, it's not possible. So you have to learn to spill it off. You have to learn to empty your cup and keep it down. You need to understand, you need to recognize there are individual differences. There are individual differences in your social support, in your ability to communicate, in your social network. It is, see why Finland or any other country is a happy country and they do not take stress, because they get into sports. And when you get into the field sports, you get into the team sports, there is a social interaction, right? So we have to identify that why, if in case I feel too much stress, there has to be drastic changes in my lifestyle that has to happen. Maybe you have to go for your first biological reference examinations like B12. You have to get your B12 checked. You have to get your vitamin D checked. If in case it is too low, then also you start feeling bouts of depression or something like this. So, dear participants, now I request you that if you have any kind of the questions or you want to get into any kind of a discussion, you are most welcome.
Ma'am, is fear also an effect of stress?
Sorry?
Is fear also an effect of stress? It could be very
Is fear,
is it also an effect of stress?
no, I'll not say that fear may cause stress. Fear is because it can be because of your some kind of anticipated things that may happen, or something very unfortunate has happened in the past and it is a conditioned response. So fear is not because of the stress. Rather, I would say that fear will cause the stress. If in case you are in a state of constantly apprehending, right? Like if in case it is a generalized fear that something bad is going to happen, or it is a specific fear, right?
Yeah, ma'am. Because most of the, I mean, I have seen these kind of people going through this situation who are very strong, or ones, is it could be due to menopause, I don't know, or anything else. But fear of probably riding, or if somebody says they are not feeling well, they have a medical condition, they apply to themselves. Maybe they will also suffer from something similar to that.
Yes.
And that in turn causes stress.
Yes. We call this condition as a hypochondriasis also. That is,
Okay.
many times we start associating when COVID started. Many
Yeah,
of us
exactly.
also we started thinking like even a little pain in the throat, we would get anxious. I may have got it. And this happens if in case you have any kind of a comorbid condition already in yourself, we get more scared. If in case I have a coronary heart disease, or I have some kind of a asthma or anything, that will create fear because it was associated with it, and the things were not very clear. There was no reasoning, there was no rationality at that moment when it all started. But if in case we clear it with rationality, we stop watching a lot of information on the website that will curtail that kind of a fear. So that is also was with respect to a specific situation that happened, and it was for many individuals who were diabetic, or those who were having any kind of a other comorbidities. They were having extreme fear of getting COVID or dying of COVID, something like this. So that has to be dealt with more rationalization, more following the say medical procedure, not heading to any kind of self checking on Google that if this symptom is there, what will it lead to? Because Google is not a doctor, and the symptoms that you reported over here, that may even lead to HIV. Like if in case you just write it that I'm feeling fatigued, what could it be? It will show that you might have HIV. So you cannot rely on unreliable sources. You have to be very specific about it, and you have to be confident about yourself. You cannot lose it. So that fear is not because of yes, that was a momentary, that stress of COVID virus that has happened, but mostly the reason of that fear is your own comorbid conditions that is within you.
Thank you, ma'am.
Yes. Yes, any other question? Any other query?
So one question is from the participant that I feel very overexcited and not able to sleep well. How to tackle that?
Sometime I feel very overexcited. Now this again, Sujata has asked it, I think. So the thing is that if in case you're overexcited again, is it because when there is some kind of a situation that happens, like for example, if in case you have to handle a new class, or you have to handle a conference session or something, then you are excited? Or in general you are just anxious? You mean by overexcited means anxiety? You mean nervousness? Is it your nervousness?
Hello, am I audible?
Hello? Yes.
Am I audible?
Yes, you're audible.
Okay. No, actually, sometime while taking the new subject, or sometime it is happiness by seeing just the happiness of any situation. So it may, these are the two situations in which I feel this kind of feelings.
See, Sujata, as such, like, if in case we get into any kind of a situation which is pressuring us, it's very normal that cortisols are produced. The body itself gets into that kind, and get that state of over-energized, right, to fight with it. So for this reason, one thing is that we have to build our own confidence level. There should not be any doubts, or should not be any apprehensions. You should be confident that you have prepared well, and that preparation should be well on time, right? That is one situation that you have talked about, that if you have to prepare a new lesson or something. So if in case that your skill, if you hone more of your skill, you are prepared with it, that will reduce the stress, right? And the second thing that you asked was, sorry, I didn't get that.
Yes, ma'am. That is sometime when we have some happy moments. In that way also, I feel the same kind of situation.
Then it's not your fault. It's basically your hormones, your excitement that is triggered because of your biology. So that's absolutely normal for us also, that for sometimes we are excited and not able to get back to that normal level. But definitely mindfulness strategy, definitely your breathing pattern. If in case you start controlling your breathing, you can search more on mindfulness. That will help you to say maintain the neurochemicals in yourself and will help you to get out of that excitability.
Ma'am, one request to the organizers and to Dr. Naina Sharma. Whatever techniques you have spoken about today, if you could summarize and share it with all of us, probably if not immediately or not all of them, some of the practices, if we can start slowly.
Yes.
Yeah, or
I
any
can
website.
share the, sure ma'am, I can share the slideshow with you. I'll post it to the organizers and they can share it to you all.
Thank you so much. Request the organizers also to please kindly share it with us. Thank you so much, ma'am. It was really because we could relate it so well to our the present scenario, work life, personal life balance, and a lot of other issues. Thank you so much, ma'am. Very relatable and very well explained. Thank you so much.
Thank you, thank you. Because this, anyways, whenever I come on this virtual platform, it gets very difficult to connect because I'm not able to see who you are, and then those individual differences and that kind of a connect is missing. But still, I have tried my best to understand and to, come up to your expectations. Thank you so much.
Thank you
No,
so
ma'am,
much.
your session was very wonderful. Really, we thank you, ma'am, for this session on stress management. We people that are working in technical area are so deeply indulged in our work that we ourselves become machines, and we even don't know that we are stressed. So
Yes.
your session is basically an eye opener to us, and I'm sure that your advices about coping with stress will be taken by the audience and incorporate in their daily lives. Thank you very much. Thank you once again for connecting with us on this platform. Thank you, ma'am.
Thank you.